Hello dear friends, hearty welcome once again. Dear friends, in this our today's lecture, we are going to learn about the common respiratory disorders and then a little topic that is artificial ventilation and ventilator. So first of all, let us start the study of these different common respiratory disorders. Here already I have written some of the important points related with different respiratory disorders briefly at the blackboard. Let us start our study. First disease for our study is emphysema. Emphysema, this disease is caused due to the abnormal distension or abnormal inflation of alveolar sacs. All of you are known and we have studied about the histological structure of lungs. We know that the lungs include millions of small air sacs, that is alveolar sacs. And in this disorder is caused due to the abnormal distension, abnormal inflation of alveolar sacs. And this emphysema is mainly caused due to the cigarette smoking in active cigarette smokers. Okay, but it is also seen in passive smokers. Passive smokers in the sense those persons who does not perform the cigarette smoking but always inhale, or they have a company of active cigarette smokers and that's why they passively inhale the cigarette smoke, and these passive smokers are more susceptible for different respiratory disorders. Emphysema हा डिसीज प्रामुख्याने सिगारेट स्मोकिंग मुळे होतो. जे लोक ऍक्टिव्ह सिगारेट स्मोकर्स आहेत, ज्यांना सिगारेट स्मोकिंगचं ॲडिक्शन आहे, व्यसन आहे, त्यांच्यामध्ये तर हा एम्फायझेमा होण्याचे चान्सेस आहेतच. परंतु दोज हू आर पॅसिव्ह स्मोकर्स, म्हणजे जे लोक स्वतः स्मोकिंग करत नाहीत परंतु ज्यांच्यामध्ये सिगारेट स्मोक हा पॅसिव्हली इनहेल होत असतो इन द कंपनी ऑफ सिगारेट स्मोकर्स, they are also more susceptible for different respiratory diseases. Second cause of emphysema is heavy air pollution. It means due to different types of air pollutants, due to continuous inhalation and deposition of different air pollutant, it may leads to the emphysema. Now, as I said, in this disorder, it occurs the abnormal distension, abnormal inflation of alveolar sacs, and that's why the air remain filled in the alveolar sacs even after expiration. एक्सपायरेशन केल्यानंतर, एअर एक्सहेल केल्यानंतर सुद्धा या अल्व्हेओलार सॅक्स मध्ये हवा शिल्लक राहते, and that's why definitely the lungs appear quite large in size. There is increase in the lung size and also there is a shortness of breath commonly seen in these patients. Now what to do to prevent this disease? Very simple. As this disease is mainly caused due to the cigarette smoking, and that's why the person should avoid the cigarette smoking. Also, passive smokers should avoid the company of active smokers. Also, try to avoid the exposure to different types of air pollutants. In addition to that, it is advised to have the different types of bronchodilators. You know, bronchodilators means these are different types of drugs or inhalers which dilate our bronchi, which facilitate for smooth breathing. Bronchi अर्थात ट्रॅकिया, श्वास नलिकेचं डिव्हिजन होऊन प्रायमरी, सेकंडरी, टर्शरी ब्रॉन्काय ज्या तयार होतात त्यांचं डायलेशन घडवून आणण्यासाठी वेगवेगळ्या प्रकारचे इनहेलर्स मिळतात, वेपरायझर्स मिळतात, ड्रग्स त्या ठिकाणी औषधं उपलब्ध असतात की ज्यांचा वापर केला तर त्या व्यक्तीला जो ब्रीदिंग श्वासोच्छवासासाठी त्रास होतोय तो त्या ठिकाणी कमी होऊ शकतो. Also, the administration of different types of antibiotics is also prescribed. That's all about the first respiratory disorder, that is emphysema. Come to the next. Second, bronchitis. Actually, there are two types of bronchitis: acute bronchitis and chronic bronchitis. First of all, let me tell you the meaning of bronchitis. सुरुवातीला bronchitis या शब्दाचा मी अर्थ सांगतोय. You know what is bronchi? Bronchi म्हणजे काय आपल्या सगळ्यांना माहिती आहे. Just as I said, our trachea divides into two primary bronchi. Primary bronchi further undergo division to form still smaller branches, that is secondary bronchi, and secondary bronchi subsequently divide to form the tertiary bronchi. So bronchitis, itis, this word stands for the inflammation. Inflammation of bronchi is called bronchitis. Here I have written bronchitis. It is an inflammation of the bronchi. Now what is inflammation? That also one should know. Actually, in pathology, inflammation, it is quite broad concept. Inflammation ही खरी खूप मोठी संकल्पना आहे. But temporarily I would like to tell you, inflammation, it include the different physical and chemical changes taking place at the site of infection, injury, wound, whatever it may be. म्हणजे एखाद्या अवयवाला जर काही दुखापत झाली किंवा एखादं इन्फेक्शन झालं, एखाद्या रोगाचा संसर्ग झाला, तर त्या अवयवामध्ये, त्या ऑर्गनमध्ये, त्या टिश्यूमध्ये घडून येणारे जे वेगवेगळ्या प्रकारचे फिजिकल आणि केमिकल चेंजेस आहेत त्यांना एकत्रितपणे इन्फ्लॅमॅटरी चेंजेस किंवा इन्फ्लॅमेशन असं म्हणतात. It means inflammation, it include the redness, swelling, pain, etc., etc. So here temporarily you just remember the inflammation of bronchi is nothing but the bronchitis, and it is of two types, acute and chronic. Acute या शब्दाचा अर्थ होतो for a short time, थोड्या काळाकरता, and chronic means for a long time, that is prolonged. Okay, so acute and chronic bronchitis. Bronchitis is mainly caused due to different infectious microbes. Bronchitis, it is caused due to bacterial infection or viral infection. अर्थात bronchitis हा bacterial किंवा viral infections मुळे घडू शकतो, or it is again caused due to the cigarette smoking. It is also one of the cause. Also the inhalation of different air pollutants, especially the carbon monoxide, which is highly poisonous, highly toxic gas, that is mainly responsible to cause the bronchitis. Now in this disease, bronchitis, it occurs the hypertrophy and hyperplasia of seromucous cells present in the lining of bronchi. Try to understand. आत्ताच bronchi म्हणजे काय आपण बोलू. आता या सगळ्या ज्या bronchi आहेत which form the major part of respiratory tract, आपल्या एकूणच श्वसन मार्गाचा प्रमुख भाग हा प्रायमरी, सेकंडरी, टर्शरी ब्रॉन्कायच्या स्वरूपात असतो, आणि या ब्रॉन्कायचं लाइनिंग याचा अर्थ इंटरनल लेयर, ओके, अंतःपटल, it contain large number of seromucous cells which are responsible for the secretion of sticky material, that is mucus. Now in bronchitis it occurs the hypertrophy, that is increase in the size of that cells, and hyperplasia means increase in the number of cells. It means it occurs increase in the size and increase in the number of that seromucous cells present in the lining of bronchi, due to which the lining of bronchi swells. Also there is a secretion of excess of mucus. साधी गोष्ट आहे, जर त्या ठिकाणी ब्रॉन्कायच्या लाइनिंगला सूज आली ड्यू टू द इन्क्रीज इन द नंबर अँड साइज ऑफ म्युकस सेल्स, आणि त्या म्युकस सेल्स मार्फत जास्त प्रमाणात म्युकस हा चिकट पदार्थ स्त्रवला गेला, तर ऑब्वियसली देयर इज अ ब्लॉकेजेस इन द bronchi. There is a blockages in the bronchial tree and that person has difficulty in breathing. There is a shortness of breath. Also there is a regular coughing along with the green yellow sputum. It is called phlegm. अर्थात phlegm किंवा हिरवट पिवळसर रंगाचा स्पुटम हा खोकल्याबरोबर कफिंग बरोबर हा बाहेर पडत असतो. That person definitely always has a shortness of breath. श्वासोच्छवासाला त्याला त्रास होत असतो. Now what to do to prevent this bronchitis? As I said just now, it is mainly caused due to the infectious microbes, and that's why initially the proper treatment of antibiotics is necessary. In addition to that, as during bronchitis it occurs the congestion, blocking of the bronchi, therefore different types of bronchodilators, drugs, inhalers are necessary. Also the chances of bronchitis are more in cold areas, cold climatic conditions. थंड हवेच्या प्रदेशामध्ये प्रामुख्याने लोकांना ब्रोंकायटिसचा त्रास होतो आणि म्हणून द पर्सन शुड मूव टू द वार्मर अँड ड्रायर क्लायमेट. द यूज ऑफ वेपरायझर इज ऑल्सो नेसेसरी. That's all about the bronchitis. Third respiratory disease, that is sinusitis. Sinusitis, sinus infection. आता जसं आपण पाहिलं की bronchitis, it is the inflammation of bronchi. So here is sinusitis. Itis, inflammation of sinus. Therefore here I have written sinus infection. Sinus infection म्हणजे काय? Sinusitis is the inflammation of cavities around the nasal passages. Inflammation काय? थोड्या वेळापूर्वीच मी तुम्हाला सांगितलं. Inflammation of cavities around the nasal passages. Nasal passages च्या भोवती असणाऱ्या ज्या पोकळ्या आहेत त्यांच्या इन्फ्लॅमेशनला सायनुसायटिस असं म्हणतात. सायनस इन्फेक्शन असं म्हणतात आणि त्याचे पण खरं दोन प्रकार आहेत, acute sinusitis आणि chronic sinusitis. This sinusitis is either caused due to the infectious microorganism, that is bacterial or viral infection, or it is mainly caused due to the cold climate, due to the cold and also different types of allergies. Allergies काय हे थोड्या वेळानंतर मी बोलणार आहे. Now there are so many symptoms of sinusitis and it is variable from person to person. वेगवेगळ्या व्यक्तींमध्ये वेगवेगळ्या प्रकारचे सिम्पटम दिसतात. But mainly the sinusitis is characterized by headache, डोकेदुखी, facial pain, चेहऱ्याला प्रचंड दुखावा जाणवतो. Then there is a runny nose, नाकातून फ्लुइड हे कायम गळत असतं, नाक गळणं. There is a sneezing. Also there is a loss of smell. गंधज्ञान, स्मेल हा टेम्पररीली गंधज्ञान त्या व्यक्तीला राहत नाही. Also there is a nasal congestion. Congestion means we can say the partial blockage of the nasal passages due to the excess of secretion of mucus or swelling of lining of nasal passages. नाकाला किंवा nasal passagesला आतल्या बाजूने सूज आल्यामुळे त्या ठिकाणी टेम्पररीली nasal passages, nasal cavities block होतात. There is a nasal congestion and therefore that person has shortness in breath. Also there is a fatigue, fever, etc., etc. What to do to prevent the sinusitis and how one can treat the sinusitis? Actually, the self-cure for sinusitis include the nasal washing. And out of acute and chronic sinusitis, acute sinusitis does not require any treatment. But the chronic sinusitis, that is the sinusitis of long duration, require the treatment of different antibiotics, steroids, different decongestants, means the medicines, drugs, inhalers which can remove the congestion or blockages. Also it requires different cough medicines. That's all about the sinusitis. Next disease, laryngitis. Again term laryngitis. You know laryng, that is voice box, sound box, isn't it? Adam's apple. And itis stands for inflammation. So laryngitis is nothing but the laryngeal inflammation. The laryngeal inflammation is mainly caused due to again infectious microbes such as bacteria, viruses, and also due to the overuse of voice box. Overuse of voice box, overuse of larynx, and that's why this laryngitis is commonly seen in teachers, lecturers who usually have to deliver lectures, they have to talk continuously, or say in different leaders who have to give speech continuously. Okay. The main symptoms include the hoarseness of voice. Hoarseness means change in the voice quality, and that's why the person cannot speak or sing properly. In addition to that, there is a sore throat. Sore throat in the sense irritation or pains in the throat, and also there is a excess secretion of mucus, sticky material, so mucus build up, there is a cough, and person has definitely irritation or pains in the throat area. Now the prevention and treatment. Basically the laryngitis, it requires the voice rest. It requires the voice rest, and also in severe condition the use of different antibiotics as well as cough medicines is necessary. Come to the next disorder, that is pneumonia. We all are known that pneumonia, it is acute infection of lungs. It is acute infection of alveoli of lungs, and mainly pneumonia, this disease is caused due to bacterium Streptococcus pneumoniae. Streptococcus pneumoniae, pneumonia causing bacterium. But in addition to that, the pneumonia may be caused due to some other bacteria, viruses, protozoans, mycoplasmas, as well as fungi also. But the main causative agent of pneumonia is bacterium Streptococcus pneumoniae. As this bacteria mainly affects the lungs, alveolar sacs of the lungs, and therefore it affects the efficiency of lungs, it affects the uptake of oxygen. The alveoli remain filled by means of fluid, by means of mucus, as well as there is an accumulation of dead RBCs, and thus there is always a shortness in breath. That person has a chest pain, that person has a fever, chills, sweating, etc., etc. What to do for treatment? What to do to cure? First of all, as it is bacterial infection, therefore the use of antibiotics is must. Especially the penicillin, this antibiotic is necessary for the treatment of pneumonia. Also the use of vaporizer is also advised. That's all about the pneumonia. Next, asthma. Asthma, it is actually the allergic attack of breathlessness associated with bronchial obstruction and spasm. Spasm in the sense the sudden contraction of bronchi, and it leads to the breathlessness. Asthma, it is actually allergic disease. You know what is allergy? Allergy means it is hypersensitivity. In short, allergy means hypersensitivity shown by that individuals to the different normal components, to the different normal substances. Say for example, the dust, it is a normal material, or pollen grain suspended in the atmosphere, it is a normal material. But due to the inhalation of such materials, it may cause the hypersensitivity, it may cause the allergy. And that's why the asthma, it is considered as allergic attack of breathlessness, and it is associated with the bronchial contraction, bronchial obstruction. So here I have written that the main cause of asthma is allergens. Allergens means the material substances which can cause the allergy, hypersensitivity. Okay. In this disorder, there is the excess secretion of mucus in the bronchi. Also, there is a clog in the bronchi, bronchioles, and person has always difficulty in breath. There is a shortness of breath. So, to avoid the asthma, first of all, one should avoid the exposure to different types of allergens. ज्या व्यक्तीला अस्थमाचा त्रास असेल त्या व्यक्तीने शक्यतो ज्या allergensमुळे मग ते पोलन ग्रेन्स असतील, डस्ट असतील किंवा ॲनिमल्स फर, ॲनिमल्स बॉडी हेअर्स यांच्या इनहेलेशनमुळे पण अस्थमाचा अटॅक येऊ शकतो, त्याला अवॉइड केलं पाहिजे. ऑल्सो one should use the different types of inhalers or vaporizer just to get the quick relief from the asthma and breathlessness. Come to the next, that is silicosis and asbestosis. Actually, silicosis and asbestosis are known as occupational lung diseases. Occupational lung diseases. It means these are the lung diseases, these are the respiratory diseases which adversely affect the lung capacity, lung functioning, and mainly due to the exposure to the silica and asbestos dust at mining industries. That's why the mine workers, खाणकाम करणारे जे लोक आहेत, खाणकाम करणारे जे वर्कर्स आहेत, त्यांच्यामध्ये प्रामुख्याने अशा प्रकारच्या ऑक्युपेशनल रेस्पिरेटरी डिसीजेस दिसतात. का? बिकॉज ॲट द मायनिंग there is always a chance of inhalation of dust of silica or asbestos, and it occurs the continuous accumulation of that dust into the lungs. It impairs the lung working, it impairs the lung efficiency, lung functioning. During asbestosis and silicosis there is lung fibrosis. Fibrosis in the sense proliferation of fibrous connective tissue, more development of fibrous connective tissue within the lungs, and it affects the breathing capacity of lungs. And that's why it is always advised to the mine workers to use the different gears. Gears in the sense the garments or different clothing such as mask, etc., to avoid the inhalation of these dust particles. Also, some remedies are there. The regular medical checkup of mine workers are necessary. Then also there should be a regular breaks in their working hours, etc., etc. That's all about the different respiratory disorders. Now let us talk briefly about two more little concepts, that is artificial ventilation and ventilator. Let us move. Artificial ventilation. It may be known as artificial respiration. Artificial ventilation or artificial respiration is the method of inducing breathing in a person in which the natural breathing has ceased, has stopped, or faltering. That is, natural breathing has ceased or the breathing is taking place at very slow rate. Now, this artificial ventilation may be carried out by mouth to mouth respiration or by using the machine known as ventilator. During this artificial ventilation, the two main steps are necessary. First one, establishing and maintaining the air passage up to the lungs. अर्थात आर्टिफिशियल रेस्पिरेशन, आर्टिफिशियल व्हेंटिलेशन, कृत्रिम श्वासोच्छवास या प्रक्रियेमध्ये दोन प्रमुख गोष्टी आवश्यक आहेत. एक म्हणजे टू क्रिएट अँड टू मेंटेन द एअर पॅसेज अप टू द लंग्स. फुफ्फुसांपर्यंत योग्य पद्धतीने ऑक्सिजन, कार्बन डायऑक्साईड किंवा हवा याचं ट्रान्सपोर्टेशन होण्यासाठी एअर पॅसेज क्रिएट करणं, तो मेंटेन करणं, आणि दुसरं टू फोर्स द इन्स्पायरेशन अँड एक्सपायरेशन. आणि नंतर दुसरी स्थिती इन्स्पायरेशन म्हणजे हवा त्या पेशंटच्या फुफ्फुसांमध्ये ढकलणं आणि परत बाहेर घेणं. ऑफ कोर्स if this artificial ventilation is carried out efficiently, quickly and properly, then it can save the life of that person. Also, it avoids the death of individual, maybe due to suffocation, maybe due to the electric shock, drowning, breathlessness, etc. etc. So, I said just now that artificial ventilation may be carried out by mouth to mouth ventilation, mouth to mouth respiration. You might be known that there is a special technique. The person, first of all, that patient is allowed to lying down on the ground, and then another person puts his mouth on the mouth of that person tightly and forcefully pump the air into the lungs, into the respiratory tract of that patient. But the most efficient way is the use of machine known as ventilator. Let me talk. We all are aware, ventilator, this machine, it supports for artificial ventilation of that person, especially during surgery, or the persons who have severe pulmonary disease, severe lung disease, they are supported by using these artificial ventilators. The main function of this ventilator is getting of oxygen up to the lungs as well as withdrawal of carbon dioxide from the lungs, means it facilitates the smooth breathing, smooth artificial breathing in that person. So it is considered as one of the very important technique used in medical field. That's all about this topic. Let us stop here. Thank you.